So if you're pregnant right now, then you may be a little bit concerned about taking paracetamol in pregnancy, because President Trump has recently claimed that taking paracetamol in pregnancy has been linked to autism in children. Whilst most of you are sensible enough to ignore any health advice from President Trump, I know that it will cause some significant anxiety among some of you at a time when you're stressed enough trying to grow a baby. So let's have a look at the actual evidence and try and understand where Trump's claims are coming from and do they actually have any basis. Paracetamol is a drug that's used really commonly in pregnancy in the UK, used mainly to treat fever and pain. So where has this claim actually come from? So to be fair, there have been some studies in the past that have made an association between paracetamol use in pregnancy and ADHD and autism. However, these studies were really poor studies, so they relied on mums trying to remember years before what they took in their pregnancy and didn't correct for other things like environmental factors, genetic factors. So in healthcare, if there is an association such as this, then what we often do is conduct a robust study to see whether that association is actually true. So what happened? A huge study was conducted of 2.4 million children in Sweden that specifically looked at the association between paracetamol use in pregnancy and ADHD and autism. Now, this was a really strong study, not just because they used 2.4 million children, which is a huge sample size, but also they corrected for other things. So for instance, they compared brother and sister siblings whose mum took and did not take paracetamol in pregnancy to correct for genetic and environmental factors. So what did this study show? Absolutely no evidence between taking paracetamol in pregnancy and the development of autism. So what that more robust, larger study has shown is that the association earlier shown by the smaller, poorer quality studies is not founded. So back in the UK, the MHRH, who regulate all our medicines in the UK, the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives, have all come out to publicly reassure pregnant women that paracetamol use is very safe in pregnancy. And whenever we withhold a treatment in pregnancy, it's always important to consider what the consequences of not taking the treatment. So we know that paracetamol is used to treat fever and pain. Not treating those carries far more risk than taking paracetamol. For instance, fever and pain in pregnancy can lead to preterm birth and the consequences of having a baby preterm. Of course, any drug in pregnancy should be used for the shortest period at the lowest dose possible, but please be reassured that taking paracetamol in pregnancy carries no proven risk. If there's one take-home message from this, it's please do not make health-based decisions on medical misinformation from the press, especially if you're getting your information from President Trump. If you're unsure about anything, please speak to your GP, your midwife, your obstetrician, and we're more than happy to discuss the risks and benefits of any treatment with you in pregnancy. That way you can make an informed decision about whether you want to take that treatment based on actual scientific evidence.